exciting field. Okay, we're getting recorded now?
Yes.
Great. Okay. So I'm Kathy Kniepmann. I'm on the faculty in Occupational Therapy. It's a very exciting profession that combines life science, social justice, and a whole lot more in very important ways that help people live their lives to the fullest. That's the OT motto, living life to the fullest, regardless of physical, cognitive, or psychological limitations, regardless of SES. We feel that everyone deserves to live a full life and a meaningful life and pursue their dreams. I have along with me two of our graduate students. I'll let them say something about themselves briefly. Molly?
Yeah, so hi everyone. I'm Molly. I'm a third-year doctoral student in the program, and I'll say more about myself later. But
my name is Mary, and I'm a first-year, will be second-year master's student in the program.
Okay, occupational therapy. Some people have never heard of it. Some people think, oh, it's just for kids. Some people think it's to help people find jobs. So I think I'll start out with a 3-minute video that April is going to turn on, and it gives you a quick overview of occupational therapy. Blind drawings, but I think it's a lot of fun.
Okay. So hopefully it won't be my turn to have lots of technological problems. Okay, hold on, let me share this. Okay, can you all see the screen? Okay. If you can't hear it, let me know.
We all have life goals, things we need and want to do. Sometimes things get in the way of our goals. Life events can make our goals seem impossible.
I love gardening, but it's difficult because I have arthritis.
I want to drive my car, but I couldn't after my stroke. I need to find a job, but it's been challenging since being diagnosed with schizophrenia.
I want to make new friends, but it's hard because I have autism.
I need to get dressed in the morning, but I just had a hip replacement and can't bend forward.
I have difficulty managing my responsibilities because of my anxiety disorder.
I haven't been able to ride my bicycle since I had a brain injury.
I need to do my grocery shopping, but it's difficult to remember when I have dementia.
It's tough to care for my baby because of my carpal tunnel syndrome.
I need to walk my dog, but I have multiple sclerosis.
I want to learn the guitar, but my right arm is amputated.
I have a spinal cord injury, but I want to live on my own. My occupational therapist helped me to achieve this goal.
Occupational therapists help people to find the tools and strategies they need to overcome barriers such as illness and disability and reach their goals.
Now I live on my own.
I'm learning the guitar.
I can walk my dog.
I can care for my baby again.
I am able to do my grocery shopping on my own.
I can ride my niece's special bike.
I am working on managing my responsibilities.
Now I can dress myself.
I'm making new friends.
I'm working with my OT to find the right job for me. My OT helped me to drive again.
I have a garden now.
Because of occupational therapy,
I can.
Okay. You ready for me to stop it? Okay, let me try to, hope nothing else is about to come on. Okay.
Okay, great. So any questions about that video?
Let me get rid of the video.
Okay, so the video showed how occupational therapists help people live meaningful lives, do the things that they want and need to do. And you saw some use of assistive technology like the long-handled reacher or an adapted bicycle. You also saw that the OT helped someone link with community resources. The child on the autism spectrum who wanted to make friends got into theater and had a great time. And you also saw that the OT was helping someone who had trouble with memory to make lists and to organize new ways of doing things. So it gives a quick overview. There's a whole lot more to OT, but I think that this captures some of the essence. So let's move on to some of our questions. Molly and Mary, would you like to tell us an overview of your career path, your educational path too?
Yeah, I can start. So I actually got my undergrad degree in therapeutic recreation from the University of Iowa, and then came to Washington University, obviously to pursue a degree in occupational therapy. I don't have a clear career path of what I want after school, but just from experiences, I'm interested in a career in pediatrics of some sort. So I'm still very open in exactly what I want to do, but that's really why I love occupational therapy, because there's so many different avenues that you can pursue, and you don't necessarily have to make a decision super early on. You can just kind of see what you like throughout the program and throughout even getting jobs. So.
Wonderful, thank you. Mary, tell us about you.
And I received an undergrad degree in psychology and Spanish from a small school in Iowa. After that, I actually worked for a couple years at a nonprofit doing young adult program development, and then decided to come back to school for occupational therapy this past fall. And I also do not really have a direct, clear path. I really, really love working with young adults. I could picture myself working in a school setting. But again, just kind of echoing what Molly said, the field is so broad and we are in so many settings, working with so many different ages. So I'm very open right now to the possibilities. And then I'll also say that psychology is a more common degree, but we have people who majored in dance, who majored in history, who majored in just a lot of different things. So it doesn't have to be one of those hard sciences or social sciences. And actually, I think it creates more diversity in the profession and helps you in different ways. So.
Okay, so thank you for sharing that. We have students with all sorts of majors, undergraduate majors. Some come straight to OT school when they finish their bachelor's degrees. Others work for several years. And with Washington University, our program has a special arrangement with WashU Danforth campus that you can apply when you're a junior. You need to fulfill all of the WashU degree requirements by your end of your junior year, and you need to take our prerequisite courses. But you can apply as a junior and then get in as a senior and do kind of official double dipping, where you're first year graduate student at the same time that those courses are counting as elective towards your bachelor's degree. So I'm going to launch into what are the educational requirements for the profession, what colleges or admissions committees looking for, application tips. Educational requirements, you need to have either a master's or a doctoral degree in occupational therapy to take the national exam and then to practice as an OT. There have been some debates about whether to make it doctoral requirement, but for now it's master's or the option of doctoral. Each school has its own prerequisite courses. There's a lot of OT schools all over the country. I like ours the best, but I'm biased. So as you're thinking of OT schools, you might want to look at schools that are close to home as well as here, or interesting places to live, and check their websites to find out what are their prerequisite courses. A lot of schools require physiology. A lot of schools require developmental psych and abnormal psych. A lot of schools require statistics. Some require anatomy. Ours does not require anatomy. What qualities admissions committees look for, I think universally, we're looking for people who have a passion for working with people, an appropriate perspective and respect about disability issues. Some schools require that you do a certain number of hours of OT observation or volunteering. We require 30 or more hours of volunteering or working with people who have disabilities. I think regardless of what school you're thinking of, this summer is not an easy time to find opportunities to do volunteering, but our website lists a lot of alternatives to the volunteering, so I'll be glad to send out that information to all of you. Application tips, I would say look in advance at what the different schools require. Almost all schools participate in OTCAS, Common Application System, and I'd say look into that after middle of July, maybe end of July, to see what kinds of things they're asking for. And they close the application system usually early July and clear out all of the information, and then they take in new applications late in July. So the last thing you'd want to do is fill in your whole application or fill in part of your application a year in advance, and then it gets wiped out and you have to start over from scratch. I'm going to move on to the next question of talk about OT school. What is it like? What is or what were the most useful and the most challenging aspects of this experience? So, Mary, this time I'll call on you first, and then I'll call on Molly.
Okay, so OT school has been very hands-on and application-based. It's not a lot of like memorization. We're practicing things hands-on in small groups together. Honestly, it's not a lot of papers or a lot of tests. It's more, like I said, just practicing skills. It has been very useful for me to work in small groups. I'm learning from my classmates. I'm learning from my professors. We have a lot of OT clinicians that come in to mentor us, which has been very helpful, and across settings, across like ages, populations that clinicians work with. I think some challenging things has been transition to online learning with it being so application-based, but the profession is so adaptable, which I think is so beautiful about it. And so it's been a good challenge to kind of adapt the way that I'm learning, adapt the way that I'm studying and applying what I'm learning. So it has been a good challenge. And then the other challenge, I think, is just kind of explaining what OT is and advocating for it. Again, a good challenge. And we have been given opportunities to practice that, working on interprofessional teams and just learning more about OT's role and how that might look different in different settings.
Thank you. Molly, what would you say about the most useful and most challenging aspects of OT school?
Yeah, so I would say useful. It's very collaborative. You're always working either with peers in small or large groups. So it's useful in gaining experience in collaborating with people that are similar like to you and very different from you. So that's really, I think, a good skill that you get out of the program throughout the whole time. But it also can be a challenge at times. Sometimes you're managing different groups of people, trying to figure out when you're going to meet with them. And so that's a challenge as well. But so kind of a good, a useful and a challenge. But yeah, that's what I would say.
Okay. And April just reminded me that I didn't say anything about my background and myself. So I should tell you, I went to Washington University undergraduate. I majored in English literature, of all things. I loved it, but I figured I wanted to be able to make a living. I was on scholarship, and I knew I'd have to pay off a lot of bills. So I looked into what can I do, how can I combine my interest in life science, working with people, community service, and occupational therapy seemed like a great pathway for me. I worked as an OT in child psychiatry, in adolescent and adult physical disabilities and rehab, and in home health. Then I decided to get a master's degree in education and in public health. I moved up to Cambridge, Massachusetts for grad school at Harvard, then set up a college health education program up there, and also did some consulting in nursing homes and consulting on development of community health promotion and wellness programs. I really wanted to figure out how can we keep people out of the hospital, not lock them out, but decrease the number of people who had to come in. So I was looking at health promotion and prevention. I started to miss my family more. I grew up just across the river on a farm, and I got a great job offer to join the faculty here at Washington U OT, where I do teaching. I teach 2 undergrad courses every semester, Images of Disability in Film and Literature, and Disability, Quality of Life, and Community. I do teaching on the medical campus, and I also do some of the recruitment work here. So that's me in a nutshell. I've developed some cool programs that I won't tell you all about them now because it would take too long. I'm going to move on. Well, first I'm going to check if any of our visitors today have questions for us so far. Okay, I'll move on to the next question. For Molly and Mary, what do you wish you had known before you applied to OT school and or before you entered the profession?
This kind of goes off of what Molly was saying earlier about it being so collaborative. I think I was worried that it would be competitive, I guess. And there are situations in undergrad, I think, where that's true. But once you, at least in grad school, and I just think the OT profession, especially as a whole, just values the collaboration and the process of going through things, not necessarily like the destination, but the process. And I think that would have saved me a lot of worry. I think I was unnecessarily worried about the competitiveness going in. And yeah, I've just felt wildly supported throughout that. So I definitely wish I would have known that.
Great.
Yeah, I would agree. I don't have that much more to add other than just knowing how supportive everyone was going to be. I guess I just kind of had this preconceived notion of what grad school would be like, and it really hasn't been it hasn't been as stressful as I thought it would be. There really is a lot of support for you, which is nice.
Great. So the next question might be a little tricky. Can you share a day or a week in the life of an occupational therapist? And does the role differ across specialties? If so, how? So you have not been practicing as occupational therapist yet, but you have done field work level 1, the 1-week field work. We have over 500 sites all over the United States for field work 1. And I wonder from your field work 1, if you can comment on this question.
Yeah, so I think the role very much differs between specialties or based on the setting of where an OT is working. But I would say throughout all of the settings, occupation is the focus of it. So regardless of who the population is, OTs are very concerned with the occupations or the things that that the clients or the patients need to do or want to do in their lives. They're very concerned about that. So in some of my field work so far, the OTs are assessing and maybe doing evals with a patient to see what their current level of function is, what they might be having challenges with, to get an idea for where the OT is going to treat or what occupations the OT has to work on. So that's a very broad answer, but maybe Mary has more specifics.
No, I thought she
Mary, from your field work and from your observations, can you comment on that?
I'm sorry, what did you say?
I say from your field work, or from when you did volunteering, or your mother is an OT, so maybe you got to observe OT when you were a little kid too. Do you have any comments?
Yeah, I definitely echo what Molly said about how like physically what your day-to-day looks like is a little bit different based on if you're working with kids, if you're working with adults, if you're working in a hospital setting or a school setting, whatever that might be. But the core values are definitely very obvious across the settings. And like Molly said, occupation choice for the clients and like participation and inclusion, that sort of thing, all of those are very clear. I was in an outpatient adults, helping adults get back to work after injury or disability. And a lot of time was spent really just on getting to know the client, asking them, you know, what is important to you, understanding that they are the experts in their lives and that we are resources to kind of facilitate better participation and that sort of thing. So we spent a lot of time like really like getting to know the clients, analyzing everything from what they're doing to like how their environment is to like what physical limitations they may have, and all of that kind of together. It's like a web, and just then deciding together like what actions to take. So yeah, I think that kind of overarching theme is the same across settings.
Mm-hmm. So both of you have mentioned the word occupation. And usually when people hear occupation, they think, oh, that's what I fill in on the farm. I'll list my occupation is truck driver, doctor, teacher, grocery store clerk. But occupation means something different in OT. Do you want to say a little about that? Like the different categories that we think about for occupation?
Yeah, so occupation really encompasses a lot of things, and it basically comes down to the meaningful activities that fill the time in our day. So there's a lot of different categories. We call them different things, but the basic activities of daily living include things like showering, bathing, self-care, things like that, things like to meet your basic needs. Then there's some broader ones that you might do on a day-to-day basis or you might not, such as driving, taking care of your household, maybe taking care of your children, going to work, things like that. And then there's things that we do to fill our time that we enjoy doing. It's different for everyone, but maybe more leisure activities. So yeah, occupation encompasses a lot, and it looks different based upon each client. So that's why it's really important to be client-centered and get to know them, to know what's important to them.
Yeah, thank you very much. And when we also think like in terms of productive activity, a job, what most people think of is your occupation, but also other kinds of work, like being a student is work, right? So student will be productive activity. For some people, volunteering might be a productive activity. For other people, it's more like leisure. They find ways that they can share their talents in fun ways. So I'm going to move on to the next question. Can someone talk about an interesting or a typical case and the role that you played, including key skills as an OT? I could maybe kick this off with a story that I remember that really stuck in my mind. There was a young man who had a spinal cord injury from a softball accident. He was stealing a base. And stealing a base is like, that's not stealing like go to jail kind of stealing. Stealing a base. He slipped, fell, twisted, and broke his neck essentially. He has a high-level spinal cord injury. And he was very dependent in all of his self-care. After that injury, he went to rehab. Well, first went to acute care and then in rehab, and he really didn't get very far. He couldn't use his arms. We could use kind of shoulder movements and a little bit of elbow movement, but he was very dependent in almost everything. So he was discharged home. He said that he was eating the food that his mom put into his mouth. He was able to watch TV. He had a speaker phone, so he could talk on the phone to his friends. His parents rigged up a large control unit for the TV so he could switch channels and switch the volume on the TV. He was watching a lot of daytime soaps, and he said he felt like his life was over. He said, I feel like I'm a vegetable. Some of his friends said that they'd heard about a driving clinic, an occupational therapy driving clinic at Washington U OT school, and they encouraged him to sign up. And he's like, how am I going to be able to drive? I can't move my hands, can't move my fingers, forget it. And they said, well, his friends were saying, you should try it, Eric. I can reveal his name because he's talked about this extensively. So Eric, you should try it. They're like really nice. It's something interesting to do, and you ought to try it. And he's like, well, it couldn't be any worse than the daytime soaps, which wasn't very complimentary to us, but we like took him on in and started working with him on improving his sitting balance. That was something he was working on in PT because his trunk muscles were sort of weak. So just sitting up tall and being able to move his arms out a little without flopping over. And then working with him on a steering column that he could kind of fasten his hand into and start to move the steering column. And at first with very little resistance, and then with increasing amounts of resistance. The occupational therapy students who were closely supervised by clinicians, experienced clinicians, were guiding that work with him. They showed him, the students showed him how you can use something called a universal cup, something that you wrap around your hand, and you can put in a fork. So he couldn't use his hands very well, but they fastened it onto a splint to hold his wrist up, and then he could start feeding himself. He's like, wow, he could use that to brush his teeth, use that to comb his hair. I'll try not to fork my hair up too badly here. And he developed more skill on driving, using hand control for the vehicle. And he got an adapted van. He learned how to use voice-activated computer. Many years ago, that was something really quite novel, so we had to learn how to use that, and it was trickier to use then than now. He went back to college, finished college. He went on to law school. That was his dream. For me, that would be a nightmare, but he was pursuing his dream. He was using his adapted van, and he said that he could do most anything with his friends, except when they went to Blueberry Hill, he could not jump up on the table and dance. But to get thrown out for that, so he said maybe it protected me. He's practicing law now, and he's actually involved in consulting on design of a fully accessible amusement park. So that's a kind of quintessential great story of OT success, helping someone move from feeling shattered and totally broken to feeling like he's living his own life and living it very well. And that's one of the most dramatic stories I can think of right off the bat. But Molly or Mary, can you think of any shorter term success stories?
Yeah, I can talk about just a little bit of experience I have in the NICU, which maybe isn't as traditional of an OT setting.
What's NICU?
Sorry, neonatal intensive care unit. So with premature infants. It's maybe not a setting that a lot of people think of OT in. I know I didn't think of OT in that setting before grad school, but premature infants have some challenges with self-regulation and regulating just their own states of arousal and emotion. So OT in that setting has a large role in changing the environment to best suit the infant. So we started first thing in the morning by turning on dimmed lights in the infant's rooms to help with cyclic lighting to help the sleep cycle develop of these infants, which was just a small thing. But as we did that, we also paid attention to the infants, the circumference of their head, and whether they had a head preference of which way they were laying, and provided a lot of education to parents and other staff on altering which side the infant's head was in the bed to help So the infant was looking both ways. But I would say the largest role that I had during that field work was to provide infant massage, which helped relax and stretch the tense muscles that the premature infants have, and provide positive and not painful touch, because a lot of the touch they receive is heel pricks and painful things. So infant massage is really something that I didn't know a lot about, but got to do quite a bit of it, both doing it as a therapist, but also providing the education to the parents, because you want to have the parents as involved as possible. So that was really cool to see as well, to really teach the parents how to interact with their babies, both in the NICU and when they go home. I would say was like the most positive experience I saw. I don't have like one particular case of it, but pretty much on the daily was just trying to get parents as involved as possible, because it's a really scary time. Their infants might have a lot of tubes and wiring coming out of them, and they don't know how to react, or they're just overwhelmed. So trying to create that bond, which goes forward with them when they go home. So I think that was a really cool thing I saw.
Oh, yeah. And occupational therapists do so much education of our clients or our patients, as well as parent, family, education going into school settings at times, and explaining to teachers what's going on with a child who seems maybe kind of awkward and kind of lazy, when in fact the child may have had a very mild stroke or may have some other conditions that's interfering with their ability to perform. So we are educators like all of the time. And Mary, can you think of any examples, maybe from field work or from observations or from the clinic that you're involved with now?
Yeah, so WashU has 4 student-run clinics through our program, and what that is it provides opportunities for students to get clinical experience, so working with clients, and then it also offers an opportunity for clients that might be underinsured or uninsured to receive access to OT services. So we have 4 different clinics. One is for people who have had a stroke. One is for hand therapy. One is for people experiencing homelessness, mental health. And then the one that I'm in is for people who have had a spinal cord injury. And so for that lab specifically, we do group-based therapy, so which is very valuable. We get together with a bunch of people who have experienced a spinal cord injury. We also have peer mentors, so people who have been living with a spinal cord injury for a long time and can offer, tips and advice and suggestions and share stories. We do give some information. We also let people talk through challenges, talk through successes, that sort of thing. We set goals together. We set goals individually. And so topics might be like, for spinal cord injury, could be seating, it could be mobility in the community, it could be parenting for some people, self-management, so taking care of your health and making sure you're staying healthy, that sort of thing. So that's just another example of OT kind of in action.
Great, thank you so much. These student-run clinics are so exciting. They're called student experiential learning clinics, but they're really kind of student-run with a lot of guidance from faculty and staff to give students the background knowledge and skills, let them observe, and then let them co-treat, and then let them treat some of their own clients. It started out with our stroke clinic probably 8 or so years ago. We got concerned that there were people who were discharged from the hospital after a stroke, discharged from rehab, inpatient, who should have been coming in for outpatient care, but they didn't have any insurance, or they had very limited insurance, and they would have had to pay a whole lot. They couldn't afford it, so they just went home and were kind of stuck without additional guidance to help them recover further. There were also students who wanted more experience, so we developed the student-run stroke clinic that went so well that then we developed the hand clinic, the clinic for people who are homeless, and the clinic for people who have spinal cord injuries. So we're really concerned about social justice and equity in our program. We're also concerned about giving our students a really solid foundation of opportunity to develop knowledge and skills to practice as OTs. So the next question is rewards and challenges. I wonder if either or each of you could say something about rewards and challenges in OT, and are there any common misconceptions about OT? So first, rewards and challenges.
I mean, I think the biggest reward is just helping people live like full and meaningful lives. I think that's very rewarding. I would say a challenge is explaining OT, having to advocate for yourself and the profession, because sometimes it isn't the most well-known profession. And also maybe like, I know I sometimes struggle with having the desire to help everyone and just knowing that that's not all that realistic sometimes. I would say a large misconception is just that people think occupational therapists help people get jobs, which kind of the title might sound like that. So that just goes back to the advocacy and being able to clearly speak what the profession does.
Dr. Kniepmann kind of said this at the beginning, but I think one great reward of occupational therapy is that it's the kind of combination of science and then compassion. So we do have a lot of background in science and anatomy and biomechanics and that sort of thing. But then we have a lot of background in just like changing how we talk to people and like getting to know people and like the compassion side of it, empathy. I think it's such a privilege to get to know people on such a vulnerable level and like share in that part of their story, which is something I just love about the profession. Challenges, I kind of echo what Molly says. I think it's challenging because I want to know everything. I want to know like about pediatrics. I want to know about adults and older adults and about all of the different challenges in all of those areas. And so it makes it hard because I can't know it all, obviously, and I can't do it all. So I think just kind of figuring out where your interests are and letting yourself be open, but also kind of knowing where the scope ends of like what you can do and referring then if you need to. So yeah. Oh, and a common misconception, I'd say definitely that occupational therapists help people get jobs, and then also that we are physical therapists, I think is the other one. I think you hear physical therapy more often, so some people will interchange those. And we work very closely with our physical therapist colleagues and very valuable colleagues. I think they will focus more on the body and the bodily movements and the mechanics of the body, whereas occupational therapy, as the name says, will focus more on what people are doing and what they need to do and kind of using those things as a way to have therapy. So you like doing those activities that you want and need to do in order to improve your participation in those activities. So that's kind of the difference.
Great. Thank you so much. And that kind of reminds me of something that Eric said, the fellow I told you about with the spinal cord injury. He said, the doctor saved my life. The physical therapist helped me to get strong and get moving again. And the occupational therapist helped me to be me and to do the things that I want to do and to do the things that I need to do. For me, another challenge of being an OT is that there are times that I really want to help people and there's just not the availability of resources. They can't afford them, or there's not enough of the resources. So as a profession, we're working collectively to try to improve access, to try to change policies. A great movie that I'm going to recommend, I can't recommend it highly enough, is Crip Camp, that shows how a bunch of teenagers with disabilities went to this camp that they said was run by hippies in the, was it 1970s, early 70s maybe? And the hippies just said, oh yeah, we'll figure out ways that you can do all sorts of things rather than say, oh, we want to protect you. You can't do that because you've got this symptom or that symptom. And these teens bonded so much, and they became determined to fight for more rights for people with disabilities. And if just one of them was doing it on their own, they wouldn't have gotten very far. But by working together, they made a big difference. Occupational therapy as a profession is really working together to ensure that there's much more availability of resources and to find ways that you can manage to get services on a limited budget. So our student-run clinics are great examples of that. Okay, we're at 12:45, 12:46. Let's see, the last question is, for people considering going into OT, what are some of the key questions they should ask themselves to assess the fit? Does either of you have suggestions? As you were deciding on OT, what questions did you ask yourself?
I was going to say, do you enjoy working on teams? That's been a theme that we've been saying across this talk, but it's just constant, whether it's in school, whether it's outside of school, working on interprofessional teams. I think that's essential to the profession. So if you like working on teams, if you like supporting others through that, then I think that's a central question. The other one that I had was if you like every day to be different and you like adapting, I think this profession is for you. It's not incredibly structured. We're working with human beings who in ourselves are not always predictable. So I think if you like things very structured, I think that's kind of the, or OT is more adaptable and different every day. So.
Yeah, I agree. I don't have much more to add, but I also thought about thinking about how flexible you are and how you cope with changes. And then also just, I guess, thinking ahead to what you might want your day-to-day job setting to look like. Do you want to interact with people every day? Were you wanting to work, which you can work a lot of different places as an OT, but just if you know, oh, I'm interested in working in a hospital or a clinic or in the community, just kind of thinking about maybe who you might want to work with, or for sure if you want to work with people.
Yes, we work all over the place. We work in preschool, daycare, school systems. We work in workplaces. Some OTs are working with architects on home modifications or home design to ensure that it's accessible. I know one of our graduates who's working with a toy company on designing toys and games for kids with disabilities. We work in home health. We work at shelters for people who are homeless. We're really all over the place. One of the questions that I was asking myself when I was thinking of occupational therapy was, will I be too upset working with people who are suffering? And then I realized I would be developing knowledge and skills to help them manage their suffering, to help them live their lives as fully as possible, that I wasn't going to be curing people, but I would be helping them to really reclaim their lives and open up a world of possibilities. Not necessarily unlimited possibilities, but really a whole lot more possibilities than they thought they were going to be able to enjoy. I think now we should check in with all of you to see if any of you have questions for us.
It looks like we have a question in the chat. How can OT help people with intellectual disabilities, for example, autism?
Mary, were you working with that population before you came here?
Yes, I did a little bit, and that's actually an area of interest for me. I'm interested in working with young adults with autism or other intellectual disabilities, specifically with regard to post-secondary transition, so after high school, transitioning to life. So whether that be more education, whether that be work, whether that be recreation activities and participating in those things. So, I mean, there's a lot of different things OTs can do. We can facilitate social interactions and social skills so that people can engage better with their friends and peers. We can work with them on job-related skills if they want to get a job, if they want to volunteer. What skills do you need to be able to volunteer, and how can we kind of facilitate that? How can we change your environment to make you more independent? So like if we need to implement like a schedule for a morning routine, or practicing activities of daily living like dressing or toileting or brushing your teeth, like simple like things that you just need to do when you get up in the morning, packing your lunch, going through that process independently, are all kind of things. I mean, that would be with a child, with young adults, with adults. It kind of depends on, for the person, like what is most like the biggest barriers, and then also looking at what their strengths are. So creative, if they're super creative, if they're super visual, like capitalizing on that. If they're, you know, if they like, for kids, if they like cars or something. So really capitalizing on what they like and what their strengths are, and then looking at their barriers, and how can we kind of bridge that gap.
Thank you very much. And we have a faculty member, Wanda Mahoney, who's done a lot of work with people who have developmental disabilities, and she's doing some work with people who are on the autism spectrum as well. So thanks for that question, Irene. Next question is from Casey. For the WashU 3-2 program, what are the biggest benefits? Would you still have to take the GRE? How does the application process differ in comparison to applying after graduating undergrad? So the 3-2 program, the biggest benefits are that you save 1 year of tuition and 1 year of time. Some people say, no, I don't want to give up my senior year. So that's something to kind of think about. But other people are like, I can't wait to be an OT. I don't want to have less, oh my goodness. Can you still hear me? My computer screen looks like it froze.
We can see you, Kathy.
Yeah, we can hear you.
Oh, you can hear me too? Okay.
Yep.
Because my screen looks frozen, but it's not, I guess. So would you still have to take the GRE? Yes, you would still have to take the GRE. We are giving less attention to the GRE. It's not as big a factor in the admissions process now as it was rather recently. And some of us are lobbying to throw it out or diminish its importance even more. But I'm not in charge and I can't make that happen. Then, how does the application differ in comparison to applying after graduating or undergrad? The criteria are still the same, and there's no major difference. And Casey, if you have more questions, please contact me or type them in now. So the next question from Peyton Hockett is, what is your advice for the application process or choosing OT program to apply to? Mary or Molly, do you have any thoughts on that? Did you look at a bunch of schools? And I don't need to hear the names of what schools you looked at, but how did you decide on applying to WashU OT and then selecting our school?
I applied to a few, not a ton, but a few, just based upon my region. St. Louis was actually the one that was farthest away from where I was living. But I just applied to them. Some of them had interviews, some of them did not. But then I visited. WashU doesn't have an interview at this time, but I went in, visited, and I think I just weighed all of my factors, kind of where I would like to live, what I thought the programs had to offer, maybe the cost of attendance, the cost of living in the city. I just weighed out a lot of different factors and made the decision that way.
I echo that. Another thing I did was look at faculty and see what they're studying and what they're interested in, and kind of start thinking about what your kind of goals might be. And you don't have to know by any means, and I still don't know completely, but just kind of looking at what faculty are doing and who you might mesh with, or like might mentor you. And then when you visit, just taking note of the community atmosphere. That was big for me in a couple schools I visited. I really felt that at WashU, like they knew who I was, they knew about me, which made me feel like I belonged there even when I was just an applicant. And so I think just kind of taking note of that, like what are your top values or what you're looking for, and then kind of going across the different schools.
I tell people, think about your must-haves for graduate school, think about the nice-to-haves, and think about the things you want to avoid. So think in terms of professional and academic factors, but then also think about what I'm going to want to do in my free time. Maybe think about cost of living, geography, weather, and make those lists. And then as you look at various OT schools, how well do they align with your lists? You deserve to thrive in OT school, and which place is going to be the best fit for you. So Bridget asks, do you have any suggestions for experiences or jobs to have during a gap year between undergrad and OT school? Mary, how'd you pick your gap year activities? Were you thinking of going to OT school as you graduated, or were you still kind of exploring possibilities?
Yeah, I wasn't sure on OT school. I know Dr. Kniepmann mentioned that my mom is an OT, and that actually kind of had the opposite effect on me. I was like, that's all I know. Like, I don't really think it's for me. It fortunately and unfortunately kept going back up, which is a good thing. It took me a while. One gap year turned into two for me. I would say I wanted to do something that was, I don't know how to say this, sort of OT related, but again, I wasn't certain that that's what I wanted to do. So it worked out for me that the nonprofit I worked at had a position opening that was a new kind of challenge and experience. What I would say for a gap year though is you can do literally anything and you can apply it to OT. So I work at a coffee shop right now, and I like find ways to incorporate OT with looking at how this place is set up and the environment, talking to people, building relationships, that sort of thing. And those are just simple examples, but so you can do anything. It doesn't have to be like healthcare related, like specifically. And then I would say, and I always say this, to like, if you take a gap year, really focus on practicing life balance and integrating those practices, because those will transfer to OT school, those will transfer to after OT school, and when you're talking about it as an OT practitioner, then you are also practicing those things. So I'd say that's more important than like where you're actually working, unless you're trying to get more OT specific experience, then that would be a good choice, but you can do anything.
And I'd be glad to share some ideas with people about jobs or volunteering. Some people get a job as gap year, they'll get a job just to make as much money as they can. So they might get a job as a barista, or there's all sorts of possibilities that don't seem like they're very closely related to occupational therapy, but then they might do some volunteering with a community agency, or babysitting for a child who has disabilities, get a job as a personal attendant for someone with disabilities who needs help to get up in the morning and get dressed and get to breakfast, or evening getting ready for bed. Those kinds of experiences can be very useful too. I'm going to hold a virtual visit this Wednesday at 1:30 p.m. and any of you who are interested are welcome to sign up for that. I'll send a follow-up note to everyone. It'll be 1:30 to probably 3, more or less. And I'll have information about our program, a little more information about our program, and about application to our program. So that would be a great chance for you to find out more. It is 1 o'clock, and I wonder if anyone has a final question or a final comment. And down in the bottom of the Zoom page, there's something called reactions. And if you want to show thumbs up, was this useful for you? Or if you want to send in any comments about what else you wish you found out from this session, that would be wonderful. Thank you for the applause and the thumbs up. And I will look forward to staying in touch with any or all of you. Thank you so much for your attention. And Mary and Mala, if you want to stay on just a bit longer, and we can check in with April. Thank you.
Thanks, guys.
Bye-bye.